Hello everyone. Today topic is NSAID. Now, NSAID are a class of drug that relieve pain, reduce inflammation and bring down a high temperature, which means a fever. NSAIDs work by blocking the production of prostaglandins, chemical messengers that often are responsible for the pain and swelling of inflammatory conditions. Some of the primary indications for NSAID therapy include rheumatoid arthritis, osteoarthritis, acute gouty arthritis, ankylosing spondylitis, dysmenorrhea, and tissue damage resulting from inflammatory joint disease. The prostaglandins are the mediators of inflammation. Inflammatory response is the body's natural response that occurs immediately following tissue damage. Most of the NSAID are irreversible inhibitors of cyclooxygenase activity, thus they prevent the formation of prostaglandin and consequently reducing the sign and symptom of inflammation. Now, how NSAID work? Then, NSAIDs work by inhibit the prostaglandin synthesis, by inhibit cyclooxygenase 1 and 2. Cyclooxygenase are the enzymes which form prostaglandins from arachidonic acid. Now you look, phospholipids is occur in the membrane that release arachidonic acid, and with the help of cyclooxygenase 1 and 2 endoperoxide release, and after the endoperoxide prostaglandins with the help of prostaglandin isomerase and thromboxane release with the help of thromboxane synthase, and prostacyclin is with the help of prostacyclin synthase. Then NSAID act on these cyclooxygenase enzyme and inhibit the synthesis of prostaglandins. Now, classification for NSAIDs: non-selective COX inhibitors, preferential COX-2 inhibitors, selective COX-2 inhibitors, and analgesic antipyretic but poor inflammatory action. And there are the drugs under these categories, like in non-selective COX inhibitors category is salicylate. Example is aspirin. Acetic acid derivatives indomethacin, then pyrazolidine derivative oxyphenbutazone, phenylbutazone, and propionic acid derivative ketoprofen, ibuprofen, and naproxen. And phenamate में mefenamic acid, enolic acid derivative like piroxicam and tinoxicam. And in preferential COX-2 inhibitors, the example of the drug are pneumoslide, diclofenac, aceclofenac, meloxicam, and selective COX-2 inhibitors are celecoxib, etirocoxib, and analgesic antipyretic with poor anti-inflammatory action like paracetamol, profenazone, and naproxen. After the classification, we discuss the drugs under the NSAIDs. सबसे पहले हम करेंगे नॉन सेलेक्टिव कॉक्स इनहिबिटर्स. फर्स्ट इज एन अराइल एंथ्रानिलिक एसिड डेरिवेटिव्स, जिसे हम फेनामिक एसिड भी कह रहे हैं. These are the general structures for N-aryl anthranilic acid derivative having an anthranilic acid ring and N-aryl ring. And the drug are this category is mefenamic acid. Mefenamic acid exerts analgesic action on both central and peripheral region. However, the analgesic effect is comparatively weaker than aspirin. It also possesses a fairly good antipyretic action, but its anti-inflammatory activity is relatively weak. There is a structure for mefenamic acid: 2,2,3-dimethyl anilinobenzoic acid, and synthesis of mefenamic acid started with orthochlorobenzoic acid, react with 2,3-xylidine, condensation reaction occur with the help of potassium chromate, and potassium salt of mefenamic acid produced. After hydrolysis, HCl released and mefenamic acid produced. The uses of mefenamic acid is administered twice daily in doses of 250 mg to treat dysmenorrhea, osteoarthritis, rheumatoid arthritis, soft tissue, muscles and joint pain. Then pyrazolone and pyrazolidone derivatives. And the drug are in this category are antipyrine like a phenazone and phenylbutazone. The structure is phenylbutazone. Brand name is butazolidine. It is also used to treat inflammation and pain that result from ankylosing spondylitis, rheumatoid arthritis, gout, and osteoarthritis. Then after this, salicylates, salicylic acid derivative. And the salicylic acid derivative were the first class of NSAIDs to be used. They possess analgesic, antipyretic, as well as anti-inflammatory properties. They are also used as anti-gout drug as they promote the excretion of uric acid. These are mainly used in the treatment of arthritis. The drugs are in this category is aspirin and sodium salicylate. There is a structure for aspirin, 2-acetoxybenzoic acid. Then sodium salicylate. It is used in medicine as an analgesic and antipyretic. Sodium salicylate also acts as non-steroidal anti-inflammatory drug and induces apoptosis in cancer cells and also necrosis. After the salicylic acid derivatives, here is aryl and hydropropanoic acid derivatives. The drug is in this category is ibuprofen, ketoprofen, phenoprofen and naproxen. And here is the structure of naproxen. Naproxen is used to relieve pain from various conditions such as headache, muscle aches, dental pain and menstrual cramps. It also reduces pain, swelling and joint stiffness. This medication is also known as non-steroidal anti-inflammatory drug. The next drug in this category is ibuprofen. It is most widely used reversible COX inhibitor. It is administered orally or applied topically in the form of cream and gel. Here is the structure 2,4-isobutyl phenyl propanoic acid. And for the synthesis, we required isobutyl benzene and react it with acetyl chloride in the presence of aluminum trichloride. And then we get isobutyl acetophenone. And after this hydrogen cyanide के साथ react करके cyanohydrin बनता है. Then again react with hydrogen iodide and hydrolysis we get ibuprofen. Ibuprofen is used to treat mild to moderate painful conditions such as in fractures, injuries of soft tissue, etc. It is used in the treatment of rheumatoid arthritis, osteoarthritis and gouty arthritis. The next drug is diclofenac. Diclofenac was introduced in US in the year 1989 and is the most widely used NSAID today. Its structure features are related to both aryl alkanoic acid and N-aryl anthranylic acid. Structure is 2,2,2,6-dichloroanilino-phenyl acetic acid. The next drug is indomethacin. It is an indole acidic acid. Either the heteroaryl group present in its structure is indole. This is a structure for indomethacin 2,1,4-chlorobenzoyl 5-methoxy-2-methyl-indole 3-yl acetic acid. Then Sulindac. It is an NSAID. The structure of Sulindac work by reducing hormone that cause inflammation and pain in the body. And the Sulindac is used to treat pain or inflammation caused by arthritis, spondylitis, tendinitis or gout. The next drug is ketorolac. Used short term to treat moderate to severe pain, help to decrease swelling, pain or fever. Thank you.